My name is Tomohiro Ishikawa, and I am recording this video for you from Hamamatsu, Japan. Today's video will cover a soft tissue augmentation after GBR with titanium mesh. To maintain regenerated bone tissue, all thin soft tissue should be augmented. With this patient, the thickness was less than 3 mm, so a soft tissue augmentation procedure was indicated. Before harvesting connective tissue graft, we should measure the soft tissue of the palate, then estimate the shape and thickness of the needed graft. The flap design is exactly the same as the procedure that I used in my previous video on GBR with titanium mesh. When we make the horizontal incision, we can feel the contours of the titanium mesh with a scalpel. Carefully lay the full-thickness flap, exposing the previously placed regeneration materials. Although cross-linked collagen membranes generally degrade after 6 months, O6 can remain for more than 1 year. Before removing the titanium mesh, it is important to clean away all of the soft tissue covering it. The mesh can be raised with a small instrument like an excavator. Sometimes we have to use bars to remove the bone-like tissue over the mesh and the cover screws. Under the titanium mesh, there was adequate regenerated tissue to support an aesthetic soft tissue contour. After measuring the necessary graft size, the first incision is made perpendicular to the surface. Then, the second incision is made parallel to the surface of the palate and creates an envelope. Another deeper cut on the first perpendicular incision starts to release the connective tissue graft. This is followed by a deeper parallel incision, which defines the thickness of the final graft. Then, short incisions are made at either end of the tissue graft. Finally, the tissue graft is harvested from the site using forceps. Epithelial tissue was then completely removed from the graft. To aid in hemostasis, collagen materials was packed into the donor site. Horizontal material sutures are very effective to seal sites such as these. At the recipient site, a releasing incision was made with the same technique as we used in my previous video's procedure. The graft was then stabilized around the implant using 6-O resolvable sutures. We can precisely fix the graft to the site by suturing it to the soft tissue layer covering the regenerated bone and the palatal flap. Horizontal material sutures are used to stabilize the graft to the palatal flap. On the buccal side, an apical soft tissue layer was used as an anchor. The graft should be placed in the most critical position surrounding the implant. After completely fixing the graft to this ideal position, using horizontal mattress sutures again, and avoiding any unnecessary tension on the tissue, the flap was returned to its original location. When we close the vertical incision, we should be careful to not make an overly visible scar, in particular in the aesthetic zone. Finally, the horizontal incision was completely closed with interrupted simple sutures. These are photos showing the patient before treatment and 1 year after treatment. Prior to surgery, there was insufficient hard and soft tissue volume. To create symmetry with the neighboring teeth and correctly manage the edentulous space, we chose to use direct bonding for the final result. After 1 year, the regenerated tissue was fully stabilized and the patient was very pleased with this result.